King Gomba for what we call the sensitive and tactful reminder of how we can become more effective missionaries and workers for God. Thank you so much, Pastor. That was really a challenge for each one of us. I think one of the big problems that we are facing these days is really about this COVID vaccine. Uh, Let us remember, you see, that this is the church stand, okay? That it is encouraging. And this alone is already a clear indication that the church is taking a decided stand. We are not neutral in this recommendation. Part of it is because the church believes from the many proofs and scientific evidences that there is efficacy and that we could be more effective workers for God when we are going to have this vaccination. And it's true because this vaccination really helps us in our health. And there is really no reason in our faith or in our belief not to encourage people to undergo vaccination. But let me just give you a quick rundown of the reason for this vaccination. Now, there are actually two types of immunization. One is what we call the natural immunization, which you get when you have the germ or the virus coming into your system. The other one is the artificial, which is really the vaccination. Now, what is the difference with this? For the vaccination, it actually prepares the body for a possible invasion. That means that when the virus or when a germ is going to enter, there are already soldier cells ready to attack, okay? Whereas in the natural immunization, a soldier or a germ attacks, and that is the time that the body is already going to prepare an offensive or an antibody to fight. So now you can see which is an advantage. For instance, if you have a thief and you are already prepared for the thief to come in or a killer to come in, whereas if you have a killer and then he goes in and that's the time you prepare, you can see that it is more advantageous that you already are pre-prepared. That means you are ready. And that is exactly what the vaccine does. It prepares you for an attack, whereas the natural immunization, it waits for an attack and then prepares. By the time it's already too late, and some people have died, you see? Vaccination makes the ready for a specific attack, and it's true that it is a specific, whereas the natural immunity is more what we call broad. But whatever it is very important that the body is already ready, and this is what vaccination is all about. Now, in the case of the COVID vaccine, generally there are actually two types of vaccine. One is the one that have already a dead or a killed virus that is going to be introduced. Once the killed virus enters into our body, it cannot produce any disease, but then the body is going to recognize this killed virus and it's going to make antibodies. The other one is an exposure of the a part, just to expose the body with a small segment of the virus, and yet the body is able to make what we call an antibody response to fight against that virus. Now, how can that be possible? Just by showing a small segment of the virus, and now the body is able to destroy the whole virus, okay? A good example of this actually is what we call now. This is really the virus, and we know that we have seen this several times. You have the spike proteins coming out, and inside is really the content of the virus that makes it replicate. But it is the spike protein that enables the virus to enter into the different cells of our body. Even if the virus is able to enter into, for instance, our mouth or our nose or our lungs, as long as it is not able to attach to our cells, then it cannot do no harm at all. It is just going to die later on, 3 or 5 days. But it is this spike protein that is really the one that makes it able to enter into our cells and then replicate. Now, since this spike protein is what we call the starter, okay, the starter of the virus. Now, if you even compare it with a car like this, a very beautiful car, luxurious car, comfortable car, very expensive car, but really, even if all of these facilities or very beautiful car Without the starter, this car becomes useless. This car cannot start without the starter. And similarly, the virus, no matter how sophisticated it is, without that spike protein, it is not able to attach. So if you want to destroy this virus, then you might as well destroy the spike protein. In that way, then the virus is not able to enter and cause the disease. And this is exactly what this vaccination is going to do. We actually have an antigen or a small part of the virus called the spike protein. And once introduced into the body, it makes antibodies against the virus. See? But as you introduce a foreign body, then you actually can have what we call side effects. Okay, a very good example of this is a streptococcal infection. Now, if you have a streptococcal infection and it is not really properly taken care of or inadequately treated, then the streptococcal infection would cause the body itself to form some antibodies that will also destroy, that is resulting to rheumatic fever or rheumatic heart fever. Really, rheumatic heart fever is the result of a post-streptococcal, the body trying to destroy the germ, and yet at the same time, it is going to cause havoc for the rest of the body. Similarly, if you have what we call a post-chlamydia, chlamydia is a uh, sexually transmitted disease or typhoid. If you get this fever, what happens is that the body too is going to form some allergic reaction that it is going to cause joint pains and reactive arthritis. And we know that even in normal situations, the autoimmune diseases are caused with So if that can happen with other germs, that can also happen to the vaccine. And that's the reason why we can have what we call adverse reaction, okay? And this is what we call adverse reaction. These are just some of the adverse reaction for the vaccine. Sore in the site of the injection. I myself had already my first dose of Pfizer, and I'm waiting for the second dose, which will happen in about 2 weeks' time. Yes, it's true. It was a little bit what we call sore for about 2 days. Part of it is because it's a foreign body, and of course, the injection is painful. Then you can have chills and fever and fatigue, allergic reaction, syncope. Syncope means some people can even faint, okay, because maybe of anxiety, but maybe also a response to the vaccine itself. Now, let us remember that these chills and fever, they are also a reaction of the body because then the body is reacting to the vaccine and now producing antibodies. So in some people, this is an indication that the body is really making the antibodies to be able to fight the coming infection. So do not be worried if you're going to have minor chills and fever. Normally to take about 2 or 3 days, but later on it's going to disappear. Fatigue is because the resources are being used to produce the antibodies. Hence, some people, and I also felt that I felt a little bit weak. I just felt sleepy for about 1 or 2 days, but afterwards it was okay. Allergic reaction, you can have hives, you can have itching, but it is not really serious. That's the reason why we are advising people that they stay for 30 minutes in the vaccination center so that if there is going to be any allergic reaction, then it can be taken care of. But these are very minor, what we call adverse effects of the virus. What we are afraid of are what we call this more serious form of the adverse effects, which could be anaphylactic shock. That means there is going to be difficulty of breathing. Not only that, but people are going to be choking. And sometimes people can even in death because of this anaphylactic shock, okay? And that is in any vaccine at all. You see, you can actually have that type of reaction. But this is the reason we are also asking you to stay for 30 minutes because usually an anaphylactic shock or a what we call dangerous or life-threatening shock will happen within 20 to 30 minutes after the injection. Okay, now blood clots, and this is it because you can actually have blood clots, and these blood clots can be very detrimental. We call it actually VITT, vaccine-induced thrombocytopenia, thrombotic thrombocytopenia. And these are actually known for the AstraZeneca and the Johnson vaccine. Myopericarditis, wherein there is going to be inflammation of the muscle of the heart, including the lining of the heart. And this can be seen in Pfizer and the Moderna mRNA vaccines, okay? But be careful also because you see COVID-19 itself produces blood clots. In fact, many people who have blood clots resulted in heart attacks, strokes. Not only that, but if these clots can happen in your leg, then you can have an amputation. If the blood clots can happen in the kidney, then you can have renal failure. So you can see that the virus itself is also producing blood clots. The virus too can produce what we call myopericarditis, wherein there is going to be inflammation of the muscle of the heart and the lining, you see? So which would you prefer? Getting the complications from the virus or getting it from the vaccine? And it is very, very, very rare. Whereas in COVID, you can have this very often in COVID. And I know some people, after having what we call this COVID attack, they had problems in their hearts. What happened is that they even had some heart blocks, you see? Okay, let us look at this. By a Professor Grills in the University of Melbourne, and this is just about a month ago. He actually said that the complications of aspirin is even more dangerous than the vaccine itself, okay? He said for the vaccine alone, 2 people have died out of 4 million doses of the AstraZeneca. Hey, 2 people out of 4 million, so that's very, very small. Okay, but it's a reality, but very, very small. Now, in the case of aspirin, I know a lot of people are using aspirin for joint pains and maybe for fever and also for prevention of heart attacks, especially if you're what we call diabetic and you had already history of strokes. But here are the problems of aspirin. And you can actually have 1 death per 10,000. The adverse effect of bleeding, anemia, hepatitis, intracranial bleeding, meaning inside the brain, you see? So now you can know the side effects of the vaccine compared to the ordinary aspirin. You can see that the vaccine itself is very, very negligible, okay? And we know that these blood clots usually happen in what we call young women, okay? 40 or below. The reason for that is because some of these women are already taking what we call oral contraceptives. They are taking hormone replacement therapy. And you have to realize that these contraceptives for preventing pregnancy has the side effect of blood clots. So if you are going to have taking these oral contraceptives or injectable contraceptives, and you are going to be taking also the vaccine, that could aggravate your situation of having a clots. Now, how do you know that you're actually going to have these clots? You're going to have blue spots on your skin, bleeding from the nose and gums, and immediately that means that you have to really seek help. Blood clots have not been found out most of the time, as I said, in women. Now, myopericarditis present as chest pain, increase in breathing, easy fatigability, all the time weak, exertion and breathing. This is found in the mRNA vaccine, Pfizer and Moderna. Usually it is a young male between 12 to 30 years old. And the incidence that they have found was that 56 to 69 per million or 0.0001%, okay? And recovery is very good. Most of these young boys, because they're already strong, they just can become weak, but then most of them are going to recover. So you can see that even with these side effects or these adverse effects, the virus or what we call the vaccine is very essential. Okay, now the risk versus benefits, they said that the vaccine with the blood clots are just similar when you ride an airplane. You know, when you ride an airplane, there's always a possibility of having what we call thrombophlebitis and blood clots, and they said that the blood clots possibility with the vaccine is similar to having a flight with an airplane that is 10 hours or more. And we also know, looking into what we call the risk benefits, we know that flying an airplane, you are not 100% that you are going to reach your destination. There is always a possibility of a crash. And yet, how come we are actually riding an airplane? Why? Is because we said, anyway, the risk is very, very negligible. Whereas the benefits, you can go to other places, serve as a missionary, and at the same time, you can also visit your relatives and see different places. So similarly with the plane ride, there are risks and there are benefits, but at the same time, the risk is very, very small. Now, as doctors, we have what we call the Hippocratic Oath. And the first rule of this is first, do no harm. And that is what we as physicians practice. But unfortunately, in many cases, it is not clear 100% good and 100% bad. How we wish that the issues are very clear, wherein you can have say, okay, 100% good, no side effects at all, but that is not the reality. See, so we always, as physicians and also as individuals, you should always weigh the risk versus the benefits. For instance, quinine for malaria, I tell you, I was sick with malaria in Yucca Hospital, and when I first took the medications, it was only +1. But then after about 3 days, it went to +2. I said, my, this is dangerous now. I have to really resort to something stronger. And I had to take quinine intravenous. I know that this quinine would be able to even stop my heart. There's a possibility that I can have what we call arrhythmias, especially when you give it in intravenous. Not only that, but my heart can stop. But I realized that my chances of survival was much, much better if I take quinine than if I let the malaria progress. Well, thank God. That's the reason why I am here, is because I took the risk and the benefits were actually much, much more compared to the risk. Similarly with Septrin, Fansidar, I also had a problem for malaria because I had frequently attacks of malaria in that mission outpost. Sometimes I would have blisters, and that was actually a sign that I was allergic to Fansidar. And it can be even serious, called what we call Stevens-Johnson. But I said, no, I have to take this. And I took it, and now I'm okay. But that is it. Similarly, with some of women who are taking hormonal replacement or oral contraceptives, there is always the possibility of a clot, but yet you continue to take it. The vaccine is much, much safer than all of this. So, my friends, you would realize really that it is very important that we take the vaccine and just be aware. And when the side effects happen, then we can actually rush to the hospital. But some of them, a lot of them, are actually very minor side effects. It is very important that we take the vaccine because we are racing against COVID variant. The longer people actually refuse for vaccination, the more variants are going to come. These days, we have the Alpha, we have the Beta here in South Africa, we have the Lambda coming from Peru, and we have now the Delta coming from India, and now there is the Delta Plus, which is more contagious. So friends, please, let us encourage people to get vaccinated, and also let us also be vaccinated. Anyway, for any what we call adverse effects, they always have what we call a committee that looks into it and finds out if it is directly related to the vaccine. They call it actually VERS, which is a Vaccine Adverse Event Reporting System. This is true in all of the countries, but you can always even report it in the United States or in UK, wherever it is, because then this is the one that is monitoring the side effects of the vaccine. And last of all, I think we have to claim the promise. I believe that we have to claim the promise that God is our refuge and our strength and ever-present help in trouble. But I tell you, my friends, we also need to utilize what are available so that we can be protected, and God is also going to help us. But really, my friends and fellow missionaries, yes, we are living in serious time, and our real help is God is our refuge. But at the same time, we have to take all the necessary precautions for this virus not to invade us, so that we are able to fight against it. Thank you.
Thank you so much, Dr. Llaguno. Thank you for that presentation. It has helped some of us. I've been undecided to go for the vaccine, but be assured that I'm convinced that I have to go for the vaccine. And thank you, because you are helping us to make the intelligent decisions during this time. It's very bad. I mean, now in South Africa, you wake up every morning, someone has passed away due to COVID. I had 8 of my family members who contracted COVID, and it was very bad because all of them, it happened at the same time. So thank you so much. If there are any questions, we'll allow only 1 or 2 questions because of time. Any questions?